Dr. Pippin, thanks so much for joining us here on Health Connection. Our topic is cholesterol numbers, what they mean and why they matter. And I like to start these segments off with a definition. That word cholesterol, what is a physician describing when he or she talks about our cholesterol?
Well, the cholesterol is a molecule present in every cell in your body, and it's also the precursor to most of the hormones in your body. But from a medical side, what cholesterol really means is it's the stuff that causes heart disease.
Okay. Why is it important to know our numbers?
It seems to be that higher numbers of cholesterol put you at increased risk for heart disease and strokes. And so knowing your own number will give you an idea of what your risk is of having a heart attack at some point in the future.
Okay. We hear about good cholesterol, HDL. We hear about bad cholesterol, LDL, and it seems counterintuitive because HDL means high density lipoprotein and bad cholesterol means low density. You'd think you'd want the other way around, but we hear about these two cholesterol numbers. What does each refer, and why is it important to know the levels of both, and why is one good and one bad?
Well, regardless of what they're called, it's what they do that really matters. And high density lipoprotein, HDL, tends to pull cholesterol out of the blood vessels into the bloodstream and back to a place where it doesn't cause heart disease. That's actually a little controversial, so we won't focus too much on the HDL. The LDL, there's not much controversy. That is the bad cholesterol. LDL, when in high numbers, causes fatty plaques to develop in arteries, which causes heart disease and strokes. You want to know your numbers of both. The HDL, you probably want to be above 60. Most people are probably not above 60. And the LDL, you really want to be down below 100 if you can.
Okay. You just answered the question. Ideal range for person's HDL and for their LDL.
Okay.
What's the ideal number for total cholesterol?
Well, the total cholesterol is the HDL plus the LDL plus a fraction of the triglycerides, which is a measure of fat floating around in your bloodstream. You probably want that under 200. Really lower's better. When I talk to my patients about total cholesterol, if it's flagged as a real high number, we'll talk, but I focus more on the LDL.
Okay. How significantly does high cholesterol increase a person's risk of heart attack, stroke, or other serious health complications?
We're getting new evidence into that because there was a time when it was considered probably the most significant risk factor for developing heart attack and stroke. But to be honest, when I talk to my patients now, I'm focusing on all of the things that cause heart attack and stroke and not focusing on the cholesterol. The cholesterol is a piece of the puzzle. There is a calculator that all physicians, no matter where you go, have access to, and it calculates your 10-year risk, so the risk that in the next 10 years you're going to have a heart attack or a stroke. That calculator includes age, which is the strongest predictor in that calculator, smoking, diabetes, blood pressure, whether or not you're on medicines, your good cholesterol, and your total cholesterol. So you can figure out the LDL from there. So basically, it is significant, but I can't give you an exact number, but it's probably not as significant as age and smoking and diabetes.
Okay. So let's talk about cholesterol and diet. Discuss how our diet can positively or negatively affect our cholesterol. What food should we eat and what should we avoid?
You hear a lot of people say don't eat cholesterol, like eggs and liver, foods that have cholesterol. I think most people would accept now that those aren't the most important things to avoid. The most important things to avoid are animal fats, saturated fat, butter, and beef, and ice cream. So they tend to cause heart disease and strokes more, and they tend to raise your cholesterol. Foods you can do to lower your cholesterol would be generally a healthy diet. That's vegetables, fruits, stuff that you have to chew, stuff that came from the earth, had roots at one point. That tends to lower cholesterol, but more importantly than lowering the number, that tends to reduce your risk for a heart attack, which is all we really care about.
Okay. High cholesterol. Any symptoms that we can detect, or is it only through a test?
Only through a test. I mean, very rarely when you have very high levels, you'll see these yellow spots around eyelids, but that's not a common thing. So basically it's a silent disease and you don't know you have it until you get tested.
And the test consists of what?
A blood draw. You know, there's some controversy about whether or not you need to be fasting or not. Probably going into the doctor's office in the morning, skipping breakfast, is the best way to get your cholesterol checked. But let's be honest, if you got to have your breakfast or your coffee with creamer in the morning, still get your test. It's worth it. It's not worth missing a doctor's visit just because you ate something.
Okay. At what age should we begin having our cholesterol checked, and how often?
Well, I'm not acting alone here. I've got guidelines. The American Heart Association says starting at age 20, and you should check it about every 4 to 6 years. It's individual though, just like everything in medicine. If your doctor says we need to check your cholesterol every year, go with your doctor. They have a reason.
All right. Let's talk about genetics. What role do genetics play, our family history, as to whether someone may have a problem with high cholesterol?
Probably two ways to look at this. The first is there is an inherited disease called familial hypertriglyceridemia, and there's familial hypercholesterolemia. You can have high cholesterol just because of your family. And in those cases, you're really talking about a different issue, probably not as important for general public. I don't even talk to my patients about it. For high cholesterol that runs in the family and causes heart attacks and many households in the nation, we're probably talking about a significant, at least half role of genetics in the level of your blood cholesterol. But you can't pinpoint a number unless you have a very large, well-done study, and that's impossible to do.
Okay. So let's say you have a family history of heart disease or stroke. What role can cholesterol medications such as statins play, and how do statins work?
Okay, I'll answer the second one first. Statins work at least two ways. The first way is the original way that we thought they worked, and they still work that way. They prohibit the liver's ability to make cholesterol. And so the cholesterol that's normally made in the liver and circulated around your blood just doesn't get made. So you don't have as high of a level. The second way, and probably more than this, they seem to stabilize the blood vessels around the heart so that they don't grow. They don't get thick, fatty plaques, not just by the number of cholesterol, but even outside of that. That prevents heart attacks. So the role they play in terms of the significance can be found based on pretty large trials where thousands of people took cholesterol-lowering medicines like statins for a long time, and we saw a reduction in the amount of heart attacks and strokes. That reduction wasn't humongous. So for people who have a history of heart disease, statins reduced their risk of a heart attack by just a few percentage points. And about 40 people that took a statin, one of them didn't have a heart attack. That's one way to say it. That risk is probably cut in third when you go to someone who doesn't have heart disease. They just have high cholesterol.
Okay. With respect to statins, are there unpleasant side effects? Is there any reason I don't want to take a statin?
Absolutely. Every time you start a medicine, you need to talk to your doctor about whether or not the benefit of that medicine, in this case preventing heart attack and stroke, is going to be outweighed by the negative side effects. And the big ones for statins are muscle cramps, elevated liver function tests, so evidence that it might be damaging your liver, and diabetes. So rarely, maybe 1 or 2% of the time, someone who gets started on a statin develops diabetes that wasn't going to get diabetes otherwise. So that's a rare side effect, but it's real. And then the much more common one is intolerable muscle cramps. It damages your muscles. That's about 10% of people with statins. So you'll see people with heart disease who should be on a statin that just can't take it because of that.
Okay. What other recommendations? Anything else you can tell us in order to better manage our cholesterol?
I would say the most important thing when thinking about cholesterol is to think about your risk of heart attack and stroke. So the number is one piece of the puzzle, and if your number is very high, yes, we'll recommend medication. But even if your number's low, if you're smoking and obese and have diabetes and not controlling your blood pressure and not exercising at all, you're going to find that your risk of heart attack is much higher regardless of whether or not you take a statin. So I think the most important thing people can be doing to prevent heart attacks and strokes, whether or not they have high cholesterol, is diet, exercise, not smoking, and controlling their blood pressure.
Excellent. Doctor, learned a lot. Thank you very much.
Thank you.